Hi everyone! So today we are going to continue talking about anatomy, and we did last week just the external parts, all the pieces on the outside that you can see with your eyes, and now we're going to get into more of the internal structures. And so today is going to be about the bones, and we're also going to talk about some of the joints. So a joint is just anywhere where two bones meet together. By the way, this is Quinn, and he is our newest horse, and the reason he's going to help us with our anatomy is because he's a nice bright gray color, and so our paint's going to show up on him really well. So to start off with the head, humans have 29 bones in their head, and horses have 34. So they only have a couple more, even though their head is so much bigger. And the bones in their head, they have their bottom jaw, so all from the bottom teeth, goes up, 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 all the way to the back of their head. You can see where this kind of groove is here. That bone is called the mandible, and that's the bone that they use mainly for chewing. The rest of the bones in the skull are all on top of that, so the bottom is only that one piece, and then everything else is on the top. And they are all fused together. So when a horse is young, their bones are kind of separated in their skull, and as they get older, those joints fuse together and turn it into one. So now we're going to look at his teeth. So a horse's teeth actually take up more room in their head than their brain does, which is an interesting fact that tells you that their teeth are super important if God made their teeth to take up that much space. So all horses have 36 teeth naturally, unless they're missing some. So the teeth that a horse will have, they have 12 incisors, which are the teeth in the very front. And those are the only teeth we can actually see on Quinn here. You can see he has all those front ones. Those are called incisors. Then as you go further back in his mouth, we can't see them because they're so far back, but those would be called premolars. He has 12 of those as well. And then further back is the actual molars, which is another 12. So 36 teeth total. But horses can have an additional 8 teeth, and those teeth would be the canine teeth, which normally you only see on male horses. It's more common in males, although the girls can have them as well. Normally, girl horses that have canine teeth will be more dominant because in the wild, the canine teeth, they're kind of sharp and they're used for fighting and defense. So if we look at Quinn here, you can see he has a bottom canine right there and a top canine up there. Canine teeth are sometimes removed because they don't really have a job other than fighting. They kind of just sit there in the way, and the horse doesn't really use them for chewing. So they are more likely to get plaque and more likely to have issues. So sometimes they are removed. The other 4 teeth that are very likely to be removed are the wolf teeth. And we can't see those on him. I'm not sure if he has any, but those sit further back by the molars, the premolars. And wolf teeth are different because they're not embedded in the bone the way the rest of the teeth are. They just kind of sit there on top as floater teeth. The wolf teeth don't really have a job to do. And they can cause problems. Sometimes the bit will rub on them. Sometimes the horse will have issues with getting lots of plaque and food stuck in them. And so usually the wolf teeth are removed. Alright, so I just painted on our first part of the spine, and this is the pieces of the vertebrae in the neck. So each individual segment is called a vertebrae, and in the neck the horse has 7 of these pieces. So the first one is called the atlas, and the atlas is shaped differently from the rest of them, and that bone is the only bone connected to the horse's skull. So that bone has to carry a lot of weight. Horses' heads can weigh over 100 pounds. So that bone has a really important job of connecting their head to the rest of their body. After the atlas, we have the axis, which is another unique vertebrae. It's shaped differently from the others because, again, it has a very specific job. After that, there are 5 more, and those are all shaped the same, and they just kind of help the horse to bend and move its neck. They all kind of work together and don't have a specific job. But for our first 2, the atlas and the axis, they both have joints. So our atlas, we're going to use pink for our joint color. That joint that's attached to the atlas helps the horse to nod its head up and down. So anytime the horse does an up and down movement with its head, it's that joint moving. And then between the atlas and the axis, we have another joint, and that one helps the horse to move its head side to side. So the vertebrae in the neck are called the cervical vertebrae. And so altogether, a horse has 7 cervical vertebrae in their neck. The first one is atlas, second one is axis, and then the rest are just numbered. So they are called C3, C4, C5, C6, and C7. This is the shoulder, and the technical term for this bone is the scapula. So the shoulder moves up and down as the horse walks, and you can see that there is this little groove in the bone there, and that's actually called the spine of the scapula. And that little groove is a really important piece for muscles to attach to. Because that groove is there, the muscles can kind of hook onto it, and so there's lots of different muscles attached right in this area. Then on top of that, this long piece that we have here that's kind of rounded, that is actually cartilage and not bone. So cartilage helps the horse to be more flexible, be able to move more, and it also is less likely to get broken in comparison to bone. And after our shoulder comes this bone, which goes from our point of the shoulder there all the way back here. And that bone is called the humerus. So the humerus is actually a really interesting bone because this bone helps determine how a horse's gaits are. It helps to determine if they are smooth to ride or if they're really bumpy. And so it's a really interesting bone when it comes to movement. So this bone actually has 2 joints on it. One is this pink area here. That is called the shoulder joint. And then further down, we have this joint at the back of the humerus, and that one is the only joint that can come away from the horse's body. So in this whole front leg, all of the other joints just move forward and back. But this one can actually move away from their body. So that's a big one when it comes to movement. So after our humerus, we have 2 bones here. One is the radius, which is this long bone that comes all the way down. And fused to the radius, we have the ulna. And the ulna is actually the part that makes the elbow. So after our radius, we come down to the carpal bones. Like we talked about last week, some people call this the knee, but it actually doesn't move like a knee. It's more like a wrist. So a horse has quite a few different bones in there. There's actually 11 bones total in that area, although sometimes horses are missing those bones. So one of those bones is only present in 30% of horses, and the other bone you only find in 2% of horses. So after our carpus bones, then we get into the cannon bone. So this bigger, longer bone there is called the cannon bone. And alongside that, on both sides, there are splint bones. So they will have a splint bone on this side and one on the inside of their leg as well. So those bones are actually, if the carpus is like our wrist, those cannon bones are the equivalent of this part of our hand. So they have, it would be the cannon bone that goes down, and then the splint bones that go alongside of it. So it has 3 digits in that area. So after our cannon bone, we then have 3 bones that go down into the hoof. And there's a couple different names for them. The technical name would be the phalanx bones. So we have phalanx 1, 2, and then 3 is down inside the hoof. So another way that people could say it would be P1, P2, and P3. And then lastly, the final name for these bones would be the long pastern, because that's the longer bone in this pastern area. Then there is the short pastern, because that one's a little bit shorter. And then the one down in the hoof is called the coffin bone. Then you have this little bone that comes alongside. That one's actually round. It's almost shaped like a ball. And that is called the sesamoid bone. Alright, so continuing down our spine, we have what's called the thoracic vertebrae. And again, like the ones in the neck, they are numbered. So a horse has 18 thoracic vertebrae. So they start up here at T1, which is behind the shoulder. And then they go all the way back to T18, which is the last rib. So all of the thoracic vertebrae have a couple different pieces to them. They have the spines that stick straight up. So even though we have the withers up here, this isn't the actual vertebrae. The vertebrae are down here and the spines stick up to make the withers. So the actual vertebrae sits much lower. So besides having the spines, the thoracic vertebrae also have ribs. So each individual vertebrae will have its spine, and then it runs all the way down into the rib. So there's one piece I didn't draw here, and that is the sternum. So the sternum would be the very front, where on horses it's underneath, and that is where the ribs connect to. So the first 8 ribs, which would be 6, 7, 8. So up until there, those are considered true ribs. All of those ribs connect down to the sternum. The rest of the ribs further back, the other 10, those are called floating ribs because they are not connected to the sternum. After the thoracic vertebrae, we have the lumbar vertebrae. So a horse has 6 of them. I was only able to draw 5 here, but there would be 6. And those lumbar vertebrae make up the loin of the horse that we talked about last week. So it's this little area in between our ribs and our hip. It's kind of an open area, and those vertebrae just sit there. So they are actually the weakest part of a horse's back. These lumbar vertebrae are very easily damaged, especially if you have a saddle that sits that far back. They are also the least flexible piece of the back. These vertebrae cannot move at all. The lumbar vertebrae actually have what's called wings. So they have the spines that stick up, and then they'll also have wings that stick out sideways. So after our lumbar vertebrae, we have the sacrum vertebrae, and they are actually fused together. So all the other vertebrae that we looked at have individual pieces, but on this one you can see it's one piece that has 5 spikes along it. So in between the lumbar vertebrae and the sacral vertebrae, we have this little pink point there that you can see, and that is actually the lumbosacral joint. So the easiest way to find that is because the lumbar vertebrae point forwards and then the sacrum vertebrae point backwards. So when they meet, they're kind of like this, and so if you feel along the horse's spine, you'll feel bumpy, bumpy, bumpy. And when you get to that spot in there, it's actually squishy because it's an in-between of where the vertebrae sit. So the last vertebrae that a horse has are actually in its tail. So a horse can actually have 15 to 21 bones in their tail. The technical term for those bones is the caudal bones. This would be the hip. So there's one bone here, it comes up and fuses to a bone along here, and then there's one that you can't see, it actually goes inward. And so those three bones make up the horse's hip. So attached to our hip bones, we have the femur. So this is one of the largest single bones in the horse's body. And the femur is actually interesting. You can see it has lots of different kind of lumps and bumps and curves on it. This is one of the major bones that muscles will attach to. So similar to how our shoulder has a little groove on it, this femur bone has all kinds of different areas for muscles to attach to. So coming down from our femur, we have the patella, which makes up the horse's stifle, which is the true knee. This bone actually has a true kneecap, which makes it the real knee of a horse. So after our femur, we come down to the tibia, which is this big long bone here. And fused to that, we have the fibula. So this is similar to on the front, how we have the radius and the ulna. This is the same sort of idea. The tibia is interesting because it actually carries a lot of weight for the horse. So if you think about it, the horse has this huge, big muscular area up here, and this bone has to take a lot of that weight. So coming down from our tibia, we get into the tarsus bones. And you'll remember from last week that this is actually the ankle bones of the horse. So they have a couple different little ones in there, and they have one bigger one that sticks out on the back. So in total, the horse has 10 bones in this tarsus. So after our tarsus, the rest is the same as the front. So we have the cannon bone, the splint bone, the sesamoid bone, the long pastern, the short pastern, and the coffin bone.